This video is the first in a series of videos targeted at understanding the most impactful challenges affecting large-scale system transformation initiatives, using Medicaid modernization as an example. We divided the problem space into 3 layers. At the top, we have overarching governance, standardization, and regulation bodies. In a Medicaid context, CMS comprises most of this layer, establishing and enforcing regulations, providing guidance through frameworks like MIDA, the Medicaid IT architecture, and providing funding for delivery initiatives as well as ongoing operations. Within this structure, we have state Medicaid enterprises, responsible for serving Medicaid members. Medicaid enterprises are also subject to several additional governance bodies at the state and federal levels. Within each Medicaid enterprise, an IT delivery model is in place that enables service delivery and supports the implementation of new IT changes. We'll start by defining common terms for use throughout this series and digging in on typical IT delivery model challenges, then cover challenges in each subsequent layer, exploring how these issues are exacerbated as we move up. We're interested in feedback and input from the community. The videos primarily focus on challenges rather than solutions. We want to hear from you if you have different opinions on the challenges raised or if you have solutions to offer. Alright, let's get started with defining the IT delivery model and its challenges.
We've borrowed many of the IT delivery terms from a similarly structured presentation by Jeff Patton, who's a thought leader in the product delivery space. We start describing the software model beginning with an idea or opportunity. In a traditional product sense, this is often a new product or feature or enhancement to an existing product. In a Medicaid environment, many correlate this with entire systems or architectures.
When it comes to software, these ideas are typically implemented through some form of delivery process, from planning and design through development and deployment. The process may vary depending on whether the software being implemented is COTS, SaaS, or custom, but will typically result in the creation of artifacts like alternatives analysis, delivery plans, software specification documentation, testing scenarios, automated pipelines, training and help materials, and ultimately deployed software made available to users.
Most organizations must adhere to governance, regulatory, and compliance rules underlying these activities to remain compliant with regulations and limit risk. Things like security, privacy, HIPAA, Section 508, etc. If we break down the components of this process into more general terms, people often refer to the ideas and opportunities as scope, the work needed to deliver the scope as activities, the artifacts created through the process, including the deployed software, as outputs, and the rules that must be followed at all times as mandatory compliance items. When external vendors are engaged to perform these responsibilities, it is common for the vendor payment to be contingent primarily based on the outputs, typically called out as deliverables in the contract. Organizations spend a considerable amount of time worried about their scope and the corresponding costs and time associated with the activities required to deliver the scope, and the overall quality of the outputs, in some cases the quantity of the outputs, and they measure and place most of their management attention on those activities and the outputs. We tend to measure these things because measuring them is straightforward and they are very visible. The truth is that we are doing these activities and producing these outputs for a reason. We have a current state situation we want to improve. Our goal is that the activities and outputs lead to an improvement in the future. The extent of the future improvement is often measured by the outcomes achieved by the people who use the software solutions. Typical outcomes we can readily measure might be things like the satisfaction of our users, how fast we can respond to them, or a reduction in time and effort required to perform everyday business operations. These near-term outcomes are expected to lead to an improvement in the organization's impact, which is felt at a much broader level. For a public service like Medicaid, an impact might be an improvement in population health, a reduction in the overall cost of administration, or perhaps better equity of service to marginalized groups. We could also call these outcomes, but we find it helpful to distinguish between outcomes which are immediately measurable through leading indicators and impacts which are typically delayed and harder to link back to a specific idea or solution experiment. Our primary goal is to increase our outcomes and impact with the lowest level of activity and output as possible. Let's talk about some of the challenges in IT delivery environments that prevent us from achieving this goal.
One of the most fundamental problems centers around the ideas.
That most ideas originate from people seeing opportunities to improve outcomes in the current environment, that most everyone has them, and that we have way too many of them. Way more than we can feasibly turn into outputs.
And critically, many ideas may not improve outcomes, especially if the outcomes are unclear. And we have a hard time figuring out which ideas are most likely to improve outcomes.
In many organizations, governance and decision-making processes surrounding scope ideas are often not effective or mature, resulting in the prioritization of ideas from the loudest or most powerful individuals.
In some cases, our scope might be required by external factors and can't easily be tied to a desired outcome improvement. For example, program mandates, regulatory or compliance changes, or expiring IT vendor contracts. Lastly, in high-risk environments, attempts to ensure nothing bad happens can often lead to ensuring nothing different happens, which can limit the variety of idea options making it to the starting point. For these and likely numerous other reasons, we frequently embark on IT initiatives with suboptimal scope ideas. For ideas that get the green light, we encounter a new set of issues impeding outcome achievement. A management focus on the activities and outputs can prevent us from understanding if an idea we're implementing will achieve our desired outcomes. In many cases, outcomes are not defined or clearly understood in the first place, and commonly the accountability for outcomes is also unclear.
Even if the desired outcomes are well defined with clear ownership, we may not have a good sense of the quality of the solution idea until we've been able to observe the idea implemented in a production environment and given to users. Much of the time, once we've learned this, the project is over and the funding is spent, as our planning did not provision for the ongoing care of the outcomes after initial delivery.
Combining these outcomes issues with our uncertainty about the starting scope idea often leads to considerable amount of disappointment from those on the receiving end of this cycle. The good news is that we can minimize these issues by reducing the amount of time between idea conception and the delivery of that idea to a user, otherwise known as lead time. Unfortunately, most organizations do not have governance or execution capability designed to optimize for short lead times, often quite the opposite. Many environments have not established safe-to-fail, low-risk mechanisms, preventing staff from attempting rapid experiments. The subsequent result is lead times that are much too long to provide any reasonable mitigation. Okay, let's take a step back and summarize the areas that seem to stand out in most environments as foundational challenges preventing outcome achievement through IT delivery. 1. Our inability to identify the scope that will generate desired outcomes.
2. A lack of clarity and focus on our desired outcomes. And 3. The long lead times delaying validated learning about outcome delivery. We understand it's possible you may not have or may not know if you have one or more of these typical IT delivery model problems. One way to tell is to look at current and prior IT initiatives. How often does work start that is put on hold or canceled? How well are the outcomes and the impact of each initiative measured? If measured, what level of outcome improvement was achieved? How quickly did initiatives go from ideation, or the need identified from a business area, to initial delivery, the time at which the idea was used live by a user? Answers to these questions should provide an idea of whether the 3 issues identified are present in your organization.
Alright, this concludes our IT delivery model challenges summary. Next, we'll build upon these issues to discuss challenges in large organizational environments. Hope to see you soon. Thanks for watching. In the YouTube notes, you'll find links to the next videos and ways to engage in the conversation. Look forward to hearing from you.